Good morning. I'm Representative Ben Frederick, representing Mid-Michigan. I was involved with a work group of members which was convened by the Speaker of the House to review and refine previously existing plans for ongoing COVID management. Our charge was to ensure that we put forward an ongoing COVID response policy which achieved specific goals. Greater transparency, answering the questions people have about what, why, and for how long. Removing politics from the process as much as possible. What does the data reflect? And what does that mean for public health decision makers? More local control. Move from an environment of one-size-fits-all restrictions to one better reflecting local conditions, which empowers communities. Elements of this approach are already within law in the Return to Learn proposal, which involves ongoing interaction between local public health departments and school districts using county-specific data considerations. This proposal calls for a publicly disclosed set of metrics which would allow a county public health director the option to modify existing state orders which reflect the needs of a county. This ongoing goal would be clearly stated as keeping the curve flattened. That is, not overwhelming our hospitals and health facilities while continuing to follow best practices to keep people safe. Key metrics which would be assessed to trigger this county public health option would be case rate, positivity rate, hospital capacity and hospitalizations, personal protective equipment inventories, testing capacity, and an established DHHS or CDC regulated containment and mitigation plan. All of these data points would be made available in an approachable dashboard for the public to be able to see progress and provide important clarity and certainty. There is also accountability within this plan for those counties which opt to avail themselves of this option. The data points must be continually maintained or state-level restrictions quickly resume. These key metrics came from an examination of several other states' approaches, as well as excellent feedback from doctors, public health professionals, and epidemiologists right here in Michigan. Throughout these discussions, there was an increasing confidence that moving toward a response which more centrally involved specific community needs was a natural progression in our state's overall response, which should be pursued. We are grateful that those with whom we've interacted have offered to continue to provide input as this proposal moves forward through the legislative process, and we're glad to have some of those individuals with us today. One further goal, which is less tangible, but which has come up again and again in this process, restoring hope to the people of Michigan. By answering questions such as what is our ongoing goal, what needs to be done and why, we can bring greater certainty and hope to a population which has already sacrificed greatly and is suffering. How much are we hearing, "I'm over it," or seeing people truly give up? In providing an approach such as this, we will see a lessening of the melees and cynicism which is increasingly prevalent and unleash tremendous capacity for local initiatives in our communities, all while being guided by the best science and trusted experts. It's now a pleasure for me to introduce someone that I count on as a state representative to let me know the conditions that are inherent in my constituency. Our local hospital system was at the front lines of innovation for creating one of the first COVID-specific treatment wings, identifying supply lines for personal protective equipment, and as one of our state's first on-site testing facilities. It's a pleasure for me to welcome Memorial Healthcare President and CEO Brian Long for further comments.
Good morning. Thank you, Representative Frederick. Appreciate being given the opportunity to be with you this morning. And thank all of you. It's a pleasure to be here to speak to you about the opportunity we have today. It's an understatement, to say that COVID-19 pandemic has been challenging us in ways that we could not have ever imagined. I'm still, however, awed at the incredible amount of bravery, commitment, ingenuity, and dedication that Memorial Healthcare and other healthcare leaders and providers throughout the state have been providing the communities that we serve throughout this pandemic. A little bit about Memorial. We're an independent hospital, a not-for-profit, about 161-bed facility located primarily in Shiawassee County. But we do have locations and provide services throughout Shiawassee County, Genesee, Clinton, Saginaw, and Bay counties. As a hospital administrator, my role is to assure our hospital's ability to provide the highest levels of patient care and healthcare safety for our community. That includes patients, providers, staff, and all of our partners. My approach is to bring to these top providers all of those that we can find in their fields and to have them focused on providing that care to our communities. Today, I would encourage you to do the same in considering how we can manage collectively as partners throughout this process to do a better job in utilizing data and information bilaterally that will allow us to continue to work this problem. First, healthcare providers and institutions need clear and unbiased, transparent guidelines informed by data and science. Make no mistake, there is still plenty that we stand to learn before we understand this entire virus. But we must trust the science as we learn, and hard data that must be the foundation for our policies and our guidelines. Transparency is critical, building trust in these guidelines even as they continue to evolve. Second, the bilateral sharing of this information and data is critical to hospitals. Hospitals collect and organize and submit large quantities of data throughout the organization to a variety of organizations, CMS, the CDC, state and local health officials. We know that this data is incredibly valuable. It is important also to learn how much over the course of this pandemic hospitals can value and receive this information in return. We need to have this information flowing back our way. Third, collaboration and coordination is absolutely vital. As the pandemic evolves, we need the ability to be dynamic in our response. Reflecting back on this summer, there were multiple instances where honest collaboration, coordination, information sharing between Memorial Healthcare, the Shiawassee Health Department, the state, our partners throughout the organization and the region work together. Healthcare facilities, long-term care, assisted living, to coordinate efforts. The regional hospital networks also served as vital resources for that collaboration. The group concerned virtually and served as a brain trust, if you will, of a sort, of new information sharing and trends in real time and developing best practices. As we look ahead with optimism, I would be hopeful that we realize a true bipartisan approach that will prioritize these types of same clear, transparent information sharing that's science-backed with true guidelines to follow, and continue this type of sharing of data as we move forward. Thank you.
Next, we'll welcome up Workgroup Member Representative Sarah Leitner.
Good morning. Since COVID-19 was first identified in Michigan, not a day has gone by that I haven't heard from someone in my community who is concerned about the pandemic and the way our state's response is affecting their family life. I've heard from many parents who are worried about their kids falling behind with their educations. I've listened to people who went months without a paycheck while they waited for their unemployment claims to be sorted out. I've heard from people who were living in pain while they waited for their knee and hip replacements that they were forced to delay, and people living with the uncertainty whether or not their medical condition was progressing. I continue to hear from people in my community who are worried about losing their jobs. I've also heard from many people who were in tears because they so desperately wanted to see and hug their loved ones in nursing homes. And I've talked with many people who simply want clarification about decisions that are being made based on the data. The people we serve deserve better. They deserve to have a voice in determining the COVID-19 responses that are in place in their own communities. They deserve better results, more transparency, and responsible decisions that are made based on science, not on politics. The plan we announced today provides this. It offers certainty and hope to move Michigan through the stress and confusion of this pandemic. When the data is available, you should have access to it. And when decisions are being made, you'll know why. By empowering people and listening to science, we will have a safe, sensible, and improved response to the virus as we move forward to better days ahead.
Next up, we have Representative Greg Van Workum, another member of our work group.
Thank you. Good morning. My name is Greg Van Workum, State Representative from the 91st District in Muskegon County. What we did, we set out to make a plan that is actually based on science and data. And we used public health experts and doctors to formulate a plan that works for Michigan. This is not a new concept, but a continuation of a plan House Republicans offered the governor and the people in April. We have learned more about COVID spread since April, and this plan reflects that knowledge. What I appreciate about this plan is, first and foremost, it will keep people healthy and safe. But it also creates transparency that we have not seen before about how decisions are being made. No doubt that data has been used and we have plenty of it, but now we need transparency in how data is driving decisions. This plan gives communities a path and a goal that they can work together to strive toward. I now have the pleasure to introduce Justin Grill, who's the Chief Medical Officer at Mercy Health. And I believe he's been the Chief Medical Officer since February, so it's been an interesting time for him.
Thanks, Greg. It indeed has been a little bit of a trial by fire coming into a Chief Medical Officer role. And what I would like to spend my time doing is expressing a sense of gratitude from the community to this deliberative body. When the Supreme Court made their decision that ongoing executive orders weren't consistent with the intent of the Michigan Constitution, it immediately engaged our senators and our representatives who've been out in the community talking to hospital administrators and patients alike, employers, employees, local spiritual leaders. And they have the advantage of being able to bring that information back from all across the state of Michigan. And as you heard in the introductory remarks, they also have the advantage of being able to speak with some of the brightest minds within the state of Michigan in epidemiology and speak with epidemiologists and then put what they're hearing from our communities together with the best that science has to offer in order to come up with a plan. And as a member of the community, I just appreciate the work that our representatives behind me and those who aren't able to be here, our senators are doing. I'm sure they'll be working in conjunction with our governor's office and work through this legislative process. And I would just like to pass along my encouragement to keep up the good work and listening to your constituents in the state of Michigan.
Next, I'd like to introduce Representative Julie Calley, a member of our work group and also a member of the Joint Select Committee on Oversight of the COVID-19 pandemic.
Good morning. First, I'd like to welcome my special guest today. I have with me a local nurse who just came off a night shift, worked all night, and drove here today to stand in support of this plan. So Miranda Sharp-Boiseau, thank you so much for the sacrifice that you made. I owe you more than a cup of coffee, for certain. The legislature and the medical professionals who stand before you today have fielded thousands of questions from concerned Michiganders. The people we serve long for measurable goals and benchmarks for success. Many states have had similar plans in place for months. By establishing clear metrics, we each become active partners instead of subjects in the battle against COVID-19. Counties which actively exercise precaution will see their metrics improve, and they will be rewarded with a locally focused response tailored to meet their own needs. As a member of the Joint Select Committee on the COVID-19 pandemic, I've listened to over 50 hours of testimony. The committee still has yet to be presented with key data which drove the state's decisions, such as economic closures and openings. Michiganders often feel like they're aboard a boat, tossed by the waves, uncertain as to what the future holds. And while combating COVID-19 does have all of us in uncharted waters, this plan will act as a means of navigation. Dr. Jonay Khaldoun addressed the Joint Select Committee just yesterday and confirmed that the locals know what's best for their communities. This is a year of high anxiety, and transparent policies that provide hope are overdue. Today, we deliver that hope. Representative Graham Filler.
Thank you, Rep. Kelly. My name is Graham Filler. I'm a state representative from the 93rd District. I guess I'm the closer here, and then we'll be taking some questions. 3 quick points. Number 1, this House plan is just one idea that we have, but we think it holds real merit. I would say that nobody has all the answers about how to defeat COVID in Michigan, but we're using this plan as a vehicle to bring real ideas and experts to the table so we can get closer to those answers. Point number 2, I really hope this leads to a conversation with all parties. I want to stress the importance of having all parties at the table, and I think it leads to better results, and I think it's what the people of the state of Michigan would want from their government when we take on something as serious as COVID-19. Number 3, some people might say, why? Why are you releasing a plan? And I would say it's pretty clear: to bring hope, to add transparency to the state's response to COVID, to make sure that decisions are based on local data, and working with health professionals. Thank you so much for coming, and Rep. Frederick will field some questions.
Thank you. Our group here assembled is available for questions. Yes? That's correct. This is consistent with the approach that you've seen on the Michigan Safe Start website as far as the assessment of cases, yes.
And then what's the baseline? What are you saying is the state regulatory speak right now? Are you acknowledging governor's health epidemic orders, rules? What is it?
Really, this seeks to come alongside the existing statutory authority in the Public Health Code, which the Public Health Director has utilized. So it comes alongside that as kind of your statewide protocols, if you will, and allows that path for that local decision-making with those metrics having been met. Yes, ma'am.
How do you anticipate this will move through the legislative process in terms of, do you think that this will get bipartisan support?
Representative, would you mind repeating the question for the folks watching remotely?
Thank you. Yes, I'll repeat the question. This is a little bit new for me on the Zoom-based integration. The question was, do we anticipate bipartisan support? We certainly would expect to see bipartisan support. That's certainly the goal, as Representative Filler outlined. And I do go back to the Return to Learn process, where we saw that bipartisan support established for a precise school reopening strategy that integrated in local control components, integrated in county-based data-driven decisions that was then agreed to by all parties. So we have precedent for that in our policy making, and as a governing majority, that is certainly our goal, to see that come through in a bipartisan fashion, to bring this hope and certainty to people in a transparent way. Yes.
Representative, you mentioned the return to learn plan. Do you feel that the decisions the school districts have been making are based on data and science? And do you have any fear that county will make these decisions based on local politics and how people feel about the virus?
Question was whether I had some concerns about the decision-making process for return to learn for school districts and whether politics could come in for local decision-making. I would say that we have to remember the centrality of the data. The data benchmarks are not turnkey. They are, comprehensive. They're meaningful goals for testing capacity, mitigation strategies, the actual trends on the cases themselves, positivity, and in a central place, the hospital capacity. So you're going to have a certain control measure in there in that the data must persist for these options to be initially available and to continue to be available, which really, as some of our speakers have said, integrates in the community, integrates in the public health leaders, the hospital facility leaders, to ensure that we continue these policies. What I'm looking forward to is a further engagement of local partnerships. Even from my own example in Shiawassee County, we have tremendous energy in the community for additional education, additional initiatives, best practices, but there's still a lot of uncertainty out there as far as the goal we're seeking to achieve and maintain. So I see a lot of potential being unleashed for that. But the decision-making would be rooted deeply in the data, and the data simply must be maintained, the benchmarks must be maintained to advance. But combined with clear goals, I see the people of Michigan rising to the occasion. Yeah. How do we arrive at the county level delineation? There's a couple of factors. Keep in mind that had the initial format of the governor's own plan been realized, we would have 8 different regions, potentially with 8 different realities based upon the conditions of those regions. We did an exhaustive analysis of states as diverse as California and Colorado, Indiana, numerous others. Many of those have county-based criteria as a central, if not the factor, for decision-making as far as their response. So I think there's a lot of argument to be made that counties offer that type of clarity as far as population areas and groupings of people. What we don't want to do is continue an environment of geographic captivity with broad swaths of territory and people really having lost hope in what's coming next and why. Yes.
Good morning. Thank you very much for helping your time. We've seen the governor of Ohio create a county-based program. However, it's unclear to people there whether or not the metrics involved in imposing a mask mandate by county, for instance, level up and make sense. How do you determine how the metrics influence when restrictions should be imposed at the county level? Who gets to make that decision, and how do they get judged based on decisions they're making?
Okay. Hopefully I don't have to restate the questions from the Zoom because, well, I'm not going to. But that's a great question. And you'll see within this plan that much is it's in the purview of those public health officials, either at the state level through the DHHS vehicle or within the county purview, to maintain the mitigation strategies that are appropriate. We have seen guidance change time and again in this process as things are learned, and we have to have space for that in our ongoing response. And so that's why the actual restrictions are not overly prescriptive in what we're suggesting here. We want to clearly keep things in the purview of the best scientific research that will evolve, of course, as we go on, and not in more of a political-based decision process. So I think that as we've seen throughout this, results will be judged by, again, the persistence of the data, these very real benchmarks, things that we've gotten from epidemiology and from health professionals as the key factors in looking at ongoing management of this pandemic. That's the key goal that must be maintained. And to me, the most central thing that we have to look at in judging our success is the stress on our healthcare systems. Is the curve remaining flattened? And that's where I think this conversation needs to return, and return urgently. Yes, ma'am.
We know that the legislative process contains policy. You also mentioned a database or some sort of like online resource. What sort of timeline do you have on getting this actually on the ground running, considering that this is affecting people now?
What is the timeline for things practically, in particular the database, was the question posed. We have some outstanding work that's already been done by the University of Michigan in the partnership that they've established with the state on some of the data metrics that people are able to see. We have the established website of the My Safe Start, which has gone into more detail with some of the indicators that would be informing school decisions. So I think there's a good architecture in place, and much of what we're talking about is additional refinement. The governor herself has repeatedly talked about the importance of context in addition to data, not just a data point, but the context in which that exists. And I think that we need to have important context on a lot of these data points available for people in Michigan. I think you could layer in the key metrics that we're looking at here on a county basis, but also within that dashboard, and this will be part of the legislative process, establish those items that we're hearing from the community need to be out there publicly to let people know in a more informed way what we're doing, where we've come from, where we are, and where we're going. But I think that the short answer to your question is the architecture is in place. It's a matter of refinement.
What happens if there's a major outbreak, say, here in the county or in the state university? If these reimposing state restrictions are based on 14-day average, how would the state, how would the local school respond quickly, or how would the state reimpose quickly if they need
The question is related to outbreak and speed in establishing mitigation. While the factors for establishing the local option would be along the 14-day timeline, as we said, the mitigation policies are still much faster, no more than a week, and it would typically be within 2 to 3 days as some of this data is starting to present itself. We took this from conversations that we had with individuals that are deeply involved in the public health response. The goal would be to immediately activate those mitigation strategies in that local county in that short interval of time, and then we're looking at persistence of the problem beyond that time. So you wouldn't be waiting to see what happens, over a multi-week period. There would be the initial monitoring would still be very surgical, very timely, and mitigation strategies that would be in accordance with DHHS protocols, CDC protocols, immediately engaged. Yes.
We know you guys have all been speaking of transparency, but is this something that's already up and running? And if not, how soon until all the data is
The items, the way the particular breakout of this information is not all publicly available. We have had conversations with entities like the Michigan Hospital Association that has established some of the specific metrics on their own dashboard, if you will. So there's some pieces out there, threads to collect, really. And entities such as them and others have said that they're willing to actually reformat and get out additional information in a format that's conducive to what we're trying to do as we need. So again, I think that the architecture is in place. It just takes refinement of that to achieve the goals of the policy and what people in the public expect. .5% positive was drawn from a couple of other states as being a tipping point, if you will, for mitigation or containment. It's also a key metric in our return to learn plan as to when schools are able to be in person. Yeah. question was, could a county drop all of the restrictions that they currently have if they met all the metrics? That would be a very reckless decision on the part of a public health director. So it's not just an individual decision being made. Keep in mind that public health directors do answer to a board of health or the county board of commissioners, depending on their makeup. So it is a more collaborative decision. We also, in our bill, do require input from the local chief medical officers as part of that collaborative decision-making process. So it would be a more prudent process than that.
We've got time for one more.
Please.
And then members will be available for those who are here afterward. You've got Chad Levin on Zoom.
Okay.
Representative, let me make sure we're clear here. Is this legislation going to undo current orders from DHHS Director Rutherford and MIOSHA that are applied statewide with mask mandates in businesses and public use of mask mandates in public in general? Does this legislation undo any of that existing regulations in place in the last 2 years?
It does not undo any of the existing regulations. It comes alongside the statewide response with a pathway toward interventions that reflect local conditions.
So the Gray County opt out of the mask mandates in basic businesses?
Well, again, this is data-driven, so if in the judgment of those local public health experts, there's a thought process on the data and interventions not requiring that, that's a possibility. I would point out that there's already a differentiation on face coverings within the Return to Learn plan itself, where there's different districts have flexibility in different ways in how they handle that policy based upon the prevailing conditions in their community.
Okay. Thank you, everybody, for coming. Thank you,
Thank you.
representatives.